Nurse, can you tell me why the charge nurse sent me in here? I have 20 other patients to see and I don't know why this patient's complaint is more concerning than the rest. Also, could you please cover this lady up?
Well, doctor, this patient is 3 days postpartum and has a complaint of headache and abdominal pain. We have measured her blood pressure twice, 10 minutes apart, in a seated position with her arm at her side and found her blood pressure to be 160/110. We have initiated an IV, and have her monitored in seizure precautions. I anticipate you will want a CBC-CMP, lipos, and but I have also collected the lab tubes necessary for PTT and PT as well as a type and screen. I recommend that we give labetalol 20 mg IV to start. I will report back to you with an update after 10 minutes. Also, there are no more blankets in the blanket warmer and I cannot get the video to cover this patient up, so we will have to take the hit on our Preeclamptic survey.
Can you measure her blood pressure again? It is probably too small of a cuff. Let's not go crazy, she probably just has a spinal headache.
We have already measured her blood pressure twice in the seated and semi-Fowler's position with her legs uncrossed. I have verified it manually myself. Since the time I have confirmed her blood pressure is greater than 160 systolically and 110 diastolically, we are trying to meet the standard of antihypertensives within the hour. She may in fact have a spinal headache, but we should not delay treating her high blood pressure while we rule out other causes. I am concerned she is preeclamptic and may be at risk for a stroke or seizures.
I see your point. Let's give 20 mg labetalol intravenously over 2 minutes and then let me know what her blood pressure is. If it does not improve after 10 minutes, then we will repeat it at 40 mg.
Pretend that this is a heart code simulation and you have just fast-forwarded 10 minutes. Doctor, it has been 10 minutes and the patient's blood pressure is the same. She started coughing a few minutes ago and sounds somewhat wheezy now. She told me just a minute ago that she thinks she has asthma that has never been diagnosed.
It sounds like labetalol is contraindicated in the patient. Let's give 10 mg of hydralazine over 2 minutes this time instead. Because I am a rock star and do not want this patient in my department any longer than necessary, I have already spoken to her OB doctor. She would like the patient to be started on magnesium to prevent seizures, so I will order 1 gram for bolus. They can start the drip on the floor.
1 gram of magnesium for a patient with preeclampsia is like spitting on them and will not help her reach a therapeutic threshold. The preeclampsia dose is a 4 to 6 gram bolus followed by 1 to 2 grams per hour.
Nurse, your brilliance inspires me. I will order magnesium 4 gram bolus, then let's give 1 gram per hour until she gets upstairs. Give the hydralazine to treat her blood pressure. Let me know how the patient does. If she improves, she can go to OB, if she does not, she will need to go to ICU.
Pretend one last time that you have just fast-forwarded for 20 minutes. Doctor, our patient's blood pressure is now 140/90. Her headache is improving as well as her abdominal pain. I have been monitoring her mental status, vital signs, and deep tendon reflexes, and she is tolerating the magnesium bolus and drip very well.
Great job, nurse. I will go update OB and get her admission order completed.